Hello, everyone. Thank you for coming in today on the day after 4th of July. So I hope you had a good day yesterday. Um, I am going to first tell you that I'm a little bit under the weather, so I am apologize about that. Don't have the energy level as I usually do, but we'll see what we can do today. I am excited about my interviewer today. It's a lot of different reasons. I think one of the most exciting thing for me about today's interview is that this individual is a paraplegic. Now, throughout most of the podcast, if you've been listening through my perspective as a psychologist and the person, is that obviously I come from a individual with a quadriplegia perspective, which I don't get the paraplegia perspective very often. So I'm excited to dig into that part of Derek's uh, uh, Derek's lifestyle. So his name is difficult to pronounce, but so first, I always thank the foundation for giving me the opportunity to bring this every month. The fact that they support the psychological perspective is awesome. So thank the Christopher Dana Reed Foundation. I also want to thank Angela for her continual guidance in our podcast. And today, Donna, our information specialist, who's going to be helping me out today and giving you some links on the website, on the foundation's website. And obviously Tim's the person you just heard from introduction. He's the one that's helping me through all these digital issues. And so thank you, Tim. So we're going to have Derek Vladescu. I hope I said that correctly. Derek is a Region 2 co-leader for the Regional Center Workforce Transformation in New York State. So Derek, come on and give me, and maybe you can explain what is a Workforce Transformation Center. So thank you for coming on, Derek.
Hello. Thank you for having me, Dr. John. The Workforce Transformation Center is basically geared towards improving the lives of those with intellectual and developmental disabilities in New York State. And mainly we do that by holding the staff that work with the individual served, by holding them to a high standard of ethics and code of core competencies. And we do lots of training and webinars and videos and stuff like that. We have events throughout the year. We have a website, which is just workforcetransformation.org, I believe. If anybody wants to check us out to look at our events.
So you're an educational center? Is that what you're saying?
In a lot of ways, yes.
Okay. And is it for individuals with intellectual disabilities, or is it for people who work with people with intellectual?
It's mostly training those who work. We call them direct support professionals. I don't know if you heard that term, but that's kind of like like I still have my staff. I call them my staff or my aide or my helper, but the technical term, I guess, these days is DSP, direct support professional. But yeah, they help us, and it's kind of getting away from the caregiver model to being like training us how to achieve more, do more for ourselves instead of just taking care of us. A lot of it is still taking care of us, I guess, but it's just training us to do as much as we can for ourselves.
I think we will post Derek's email. I know we have it, and Tim will put that up in one of the chats eventually, so that if you want to get in contact with Derek, you can do so. So Derek, again, thank you for volunteering to come on. Derek and I have really never spoke, and so I don't know anything about Derek. So we're going in here blind. What I do know is that Derek was interested in coming on, and I'm always excited to have new individuals come on to my podcast. Now, you spend many months always hearing about my things in my life, and as well as the psychological perspective. So I'm excited to talk about Derek's side for once instead of me. So Derek, tell me a little bit about your injury. What happened and when and how did that, how did it happen?
Okay, well, I was injured this time of year in July. I believe it was July, the middle of July 2003. After my second year of college, I was traveling abroad, and I was at a train station, and I had lost my ticket, or I had been pickpocketed, so I didn't know where I was going to spend the night. Next thing I know, I wake up in the hospital, and it's a few weeks later. The story goes is that they found me on the train tracks the next morning, paralyzed with a head injury. When I woke up and so for the first 2 weeks after my injury, I had no memory of that. Because of the head injury, like I had amnesia. So I don't know. I can't tell you 100% for sure what happened to me, but I think I was attacked. They said the train hit me, but I'm kind of doubtful, just the nature of the injury. I don't think that if a train hit me that hard, I don't think I would have survived. Yeah, so I don't really know. I broke my back, and I had impact on my shoulder. I broke my back and it hit my head also. That's pretty much what happened to me. And then that was in Madrid, Spain. And after I was injured, I had my passport on me, so the authorities called my parents and my mom and my brother and a friend who spoke Spanish, came over to be with me in the hospital and worked with the embassy to get me back to the US. So that was an event. That was an adventure. Um, yeah.
Yeah. Wow. That's I, I was not expecting that. I was thinking, oh, you had car accident or a sports related accident to have a trauma like that in Europe. And so you're young, you're in college. Um, and what level of injury did you end up having? I mean, what is
Yeah.
technically your diagnosis?
I was injured T4 to T7.
T4 to T7. So what did that leave you functionally? At T4 or T7, what can you move and what can you not?
So I have full use of my arms. Very lucky for that. I and then about my nipple level, my top of my rib cage is where I start losing sensation and function. It's not like a straight line, but I don't have full ab control, and I have no movement in my legs, no voluntary movement in my legs. I have some spasms, which I guess are good for you, can be good, to keep your muscles moving, but I don't have any voluntary movement in my legs, and my bodily functions I rely on. I have to go like I have to go to the bathroom on a schedule and all of that, and I have to cath.
So you are upper body is well technically normal, right? You got your hands and all
Yeah.
your digits. Sounds like it, right?
Yes.
So as for the listeners, I wonder how many, is anyone out there who are currently a paraplegic that's listening to our podcast today. So I want to dig in a little bit on the fact that I would consider a paraplegic, right? Individual with paraplegia. So can I assume you use a manual chair?
Yes, 95% of the time I use a manual chair, although I do have a power chair for longer distances and for um I like to use it like to go like say I go out someplace and I want to read, whether it's like to a park or something like that, then I can like tilt back in my chair. I don't have to worry as much about weight shifts, and it's more comfortable than my manual chair.
Okay. So you actually use both, which is
Yeah.
actually quite surprising because, at least for me, do you feel different being in a manual chair versus electric? And when I say different, do you your self-image when you're in the different type of mobility? Is that a factor at all?
Definitely. I thought before I got my power chair, I thought I'd be using it a lot at home because I thought it'd be much more comfortable than my manual chair. But I feel like I'm carrying the weight of the power chair when I go around the house. I'm always bumping into things, and I can't go in my bathroom because it has a tile floor, and then the tiles would crack if I went because the power chair is heavier, much heavier. So I don't use it at home so much. I feel more independent and more like freer when I'm in my manual chair because it's much lighter. But when I'm in my power chair, let's say I'm out in public, I feel like I'm like more secure. I feel like I am like if I have to calf, I could just I can tilt back my chair. I can adjust. I have more power as far as where adjusting my posture in my power chair. So that's the benefit of that.
So functionally, you're better in an electric chair. You're
In some
saying
ways, in some ways.
in some ways. Can you help me out to clarify that? What does that mean? In some ways.
Well, I have what is it called again? The eye level. I don't know if you heard of that, the eye level, which allows me to elevate myself in my power chair. And I have more options like that, but in my manual chair, I can pick up things off the ground more easily. I have more agility in my manual chair, but in my power chair, I can tilt myself back, I can lift my legs up, I can recline, and I can go longer distances. So it's a trade-off.
It's a trade-off. So it sounds like you have more agility in the manual chair, but the electric chair gives you more function. Do you ever think of how others see you and when you're in one chair versus the other?
I don't mean to brag, but I think when I'm in my power chair, people are impressed because they're like, wow, I wonder what that thing can do. Like they're just like, I think people sometimes when I'm in my power chair, they look at me and like they yeah, they're more impressed by that, and maybe they haven't seen, like, especially if I elevate myself or if I tilt myself back, like if I go to a bookstore and I tilt myself back, people will just check me out to see, like, wow, like maybe they haven't seen that before. That's the impression I get.
Do you drive in your manual chair or electric chair or both?
I drive from, it's called a 6-point seat. I don't know if you heard. It's where I transfer from my chair. I roll my chair into my van, and then I transfer onto the seat.
Right, right.
So yeah. So whether I use the power chair or the manual chair, I'm always transferring when I have to drive or when I drive. Yeah.
Okay. So you being an individual with paraplegia don't have a caregiver bugging around you very much because you're pretty independent, I'm assuming.
Most of the time I'm independent. I don't have a caregiver around me.
Do you have caregiver in your life? I mean, functionally, it seems like you're pretty independent.
I'm pretty independent. Luckily, I feel very lucky to have achieved independence at the level where I'm at now. But I have one staff, one DSP, and I live with my mom. My mom has arthritis, so she also has a disability, but she helps me morally, like moral support and just emotional support. And she'll help me, like, if I'm in bed and I forgot something, she might, if she's up, she'll get me like a drink or something. She cooks for me sometimes, so that's nice.
Oh, that's always nothing better than mom's cooking, right?
Yeah.
Yeah, my mom used to cook for me as well. So I mean, asking the listeners out there, does anyone out there have family members part of your caregiving team? Feel free to put that on the chat there. So you're telling us, a little bit about your injury and a little bit about how so what was, 2003? So that puts you at about 19 years ago.
Yes.
So tell me a little bit about the adjustment process going through that. What was it like in the beginning? When it comes to, it took me several years to realize I wasn't going to walk again. I don't know. What was your psychological process going through the beginning part?
Well, I think mine was different because of what happened to me. I went from being in a train station fearing for my life. I didn't know that I knew that I was probably in danger because I didn't think that they were going to let me sleep in the train station. Then when I woke up in the hospital, I was just glad to be alive. I was like, yeah, I knew something was probably could have happened to me. I was glad to be alive, glad to still have my mind working, and glad to have my arms, even though it sucks to be paralyzed. But I took it from the beginning as a good omen that I was still alive and everything, that I survived. As far as adjusting, like logistically, if I could talk about that,
Sure.
um, the main thing was that I went to Kessler, which is where Christopher Reeve went to for rehab, and the quality of rehab was excellent, but the discharge plan was terrible. I didn't know. My mom got me a temporary housing at a hospitality home locally to where I live in upstate New York. And because my parents' house wasn't accessible, and like most people who have spinal cord injury, their houses, most people's houses aren't wheelchair accessible. And it wasn't a matter of just putting a ramp in, so I couldn't live there, and I didn't give much thought to it. And then when I was discharged, I was faced with all these issues that I didn't have. I wasn't independent with my bowel program. I had a suprapubic catheter. I had that I needed to learn how to manage, and I had no help other than my parents and my siblings, but they were at school. So it took me about 4 years. I ended up back in the hospital. And it took me a few years of being in different hospitals and rehab centers and nursing homes before I got into my mom bought the house that we live in now.
Wow.
That was the biggest struggle for me. It was the housing issues, accessible housing.
Yeah, and I'm going to say probably that's a lot of others issues coming out of the hospital. As you stated, many individuals don't have accessible housing. Um, yeah, well, we're going to ask Tim's question in a second that he posted. So coming back to you, so you had a suprapubic, you didn't have an accessible house. So discharge was difficult because it put you in a position of having to find places to live that was not in your family's home, obviously, you said there because it wasn't accessible. I also heard that at one point you were in a nursing home. What was that like for you to be put in an institution like that?
The nursing home that I was in, it wasn't that bad. They weren't real. It wasn't. I guess it wasn't so bad for me because my parents. It wasn't that far away from my parents, and they would visit me. It was like an hour away from where my parents lived. And they'd visit me like once a week, twice a week, something like that. And I was only there for about 5 weeks, but then I was in other. I was in the hospital. I was in the inpatient psychiatric unit for about on and off for about 2.5 years, mainly because I didn't, there was no place, nobody had a place for me to go to. My family and I hadn't decided to sell the house right away. And so finally, then I got into a group home. And then that's when I went back to school for the first time after my injury. And then when my mom bought the ranch that we live in, then I've been living there since then. And it's been like, 13 years. So it's been great. The housing situation has been great once we bought the ranch.
Great, great. What was the group home process? I mean, it sounded like you started going back to school at the time. So was a group home a good experience for you because it got you to go back to school, or
Yes.
what?
Yes. It was nice. I mean, as soon as I went back to school, they made me, you couldn't just sit in the house all day. They made you either go to day program or have a job or go to school. So when I went to school, they transported me back and forth to campus. So that was great. And so I didn't have to worry about that. And then they made sure I had all my, my needs met as far as they did cooking. They made sure I had all my ADL needs met. And the staff were nice. And so it was good as a stepping stone. So I had overall a good experience in the group home. It was
You
much
said
more
it was
independence.
okay, you said it was a good stepping stone. What does that mean? Stepping stone to what?
To living on my own or living with my family to where my mom was going to buy the a house that we can make accessible. That's what I wanted. That's what I wanted to do. I wanted to live with my family since I was back with my family since I was injured.
Right. You felt that being with your family was the most secure thing for you, it
Yes.
sounded like. And
Yes.
it also sounded like more consistency. Now, I, as a question from Tim here, he says, what made you decide to have a suprapubic as a para? Because as a para, my assumption is, please tell me if I'm wrong, Derek, you can self-cast sometimes, correct? And you had the hands. So what made you decide that at the time?
Oh, that's a good question because I had a I believe it's called stenosis of the urethra, which means that I can't most of the time I cannot pass a catheter. Even when the urologist tries, he or she, but I had male urologist, could not pass the catheter. He told me urologist at Kessler suggested that I get a suprapubic because that was my best option versus having a Foley in there all the time. Suprapubic is a little bit less risk of infection, is my understanding. So I had that for 15 years. And interestingly enough, I found out from another urologist that I had another option that was even better than the suprapubic, the Mitrofanoff.
Which is,
And that's when they create a stoma or kind of almost like another urethra, but they put it in your belly near your belly button, and then it's just a tiny little opening, and then you pass the cath when you go on you just pretend like you're like a normal person would usually catheterize, and then you lubricate a catheter, pass a catheter through there, and it goes to your bladder, and then when you're done, take out the catheter and throw it away.
wow. That sounds, I mean, it sounds like less risk for infection as long as
Yes.
you keep everything nice and sterile. Because then you won't have something sticking out and a nice super highway for bacteria.
Exactly. When I had the suprapubic, I had been hospitalized about half a dozen times where I was in the hospital for a week on antibiotics and serious infections. And then since I've gotten Mitrofanoff, which is about 3.5 years ago, I've pretty much been out of the hospital. No inpatient hospitalizations.
Wow. Wow. That sounds, can you say that procedure again?
Mitrofanoff. I can put it in the chat if it would help.
That would be great. That would be great. Tell me, and Rolando mentioned about discharges seems to be a common theme for many of us who gets discharged. I was very fortunate. I had my parents were just building a house when I had my injury. So I went from a house that I could not with multiple stairs to coming home to a house that was a ranch. So Derek, I was a lot more fortunate than you. I came home to a ranch house, whereas it took you a while to get one. So can you tell me a little bit about how your injury has affected your relationships?
Yes. One thing is that when I was first in rehab, I was like surrounded by love. Like I had a lot of my family and friends were around me and supporting me. And I had a lot of friends from high school and back home and from college sending me cards. They sent me cards and just saying that they were there for me and they were supportive of me, but I didn't really respond back to them because a lot of it was I was just feeling very angry that I couldn't live the life that they were living, kind of that I was just like kind of derailed from my previous life and I wasn't with them now. And so with my friends and out doing things like I wanted to be doing, you typically do when you're 19, 20 years old. But yeah, but then along the process, like struggling so much with my medical issues and no community housing, it was like a long break where I wasn't really around people my age, and I lost contact with a lot of friends. And it was only with Facebook that I got back into contact with a number of friends. And but my parents were always supportive. My dad had cancer. He was terminally ill and he passed away about 14 years ago. But he was very supportive of me till the end. And my mom is still I still have her. She's very supportive. My extended family has been supportive as well. So it was just a matter of trying to find a balance between wanting to do everything myself and advocating for myself and having competent caregivers outside of my family, and then letting my family be there for me in ways that was acceptable to me. And like my mom could be a smother mother, so I try to say like, Mom, that's enough, I don't want you to help me with this. And then she'll just be like, oh, okay, if you really don't want me to, I won't, but I think you need this, and this. So like,
good luck with that, Derek. I don't think that's ever going to change. So she's always going to smother you. She always looks at you like you're her little kid, right, Derek? Trust me.
Yeah.
My mom stands and looks at me and is like, I'm like, Mom, come on. I don't need to be breastfed anymore. Stop it. So Derek, so here's the question for you though. So it sounds like in the beginning, your friends and, was there for you, but you sort of pushed them away because you were too angry at the situation. Is that correct to say that?
Yes.
Okay.
Yes, and I didn't. That was before Facebook. Like 2003 was before Facebook, and it was kind of like I just didn't feel like I was in a place mentally, and it was only because like it's a new I was going through a new experience, and I was like I didn't know that it would first of all be in my best interest to keep in contact with my friends, but I just felt like I'll get to it, when I get back to some kind of normality. And then that day never really comes or until many years later, and then they're kind of like your friends have moved on. A lot of my friends had moved on, or that's
No,
how.
my experience was that the first year it felt like it was come see the freak show. John was injured and all your friends come and show up. And after a while, they all dissipated really quickly. And then the core, your really good friends. Um, and I only had a few that really stuck out after that. I think one of them might be even listening today. Only the few stuck around. Did you get that at later on? That only few people was really invested in your life, or did that happen to you as well?
Yeah, right now I have about maybe like a dozen friends, but maybe that I keep in contact with fairly regularly, maybe half a dozen. There's only a few, and then sometimes it's just a matter of like I know everybody has busy lives, but sometimes I reach out to some friends, sometimes they'll get back to me, sometimes they won't, and I just have to respect their decision and try not to get upset or sad or frustrated. But
You
it's a
mentioned
two-way
that
street.
it was a difficult time for you in the first few years. Did you seek any help to this process? Did that rehab set you up for, hey, this is going to happen, and this is what you do? It doesn't sound like they might have given you any suggestions about that.
Well, when I was in rehab, there's a psychiatrist and there's a psychologist. I resisted the medications because I didn't think I didn't want to take any medications for depression. Probably if I were to do it again, I would have taken it so that I would have had a psychiatric provider on board in case, because I did end up in a crisis, ended up back in the hospital after my discharge.
Mhm.
Maybe that could have been avoided if I had psychiatry, either a nurse practitioner or a psychologist or a psychiatrist. But after the discharge plan didn't include any help, like mental health. So I kind of had to find it out myself and research it myself. Currently, I do have a psychotherapist, a psychologist, and a psychiatric provider. I think the medication that I'm on helps me a lot, and so does the talking. Like I agree with what you had said previously that having both of those gets the quickest results. So I couldn't stress that anymore. I know that even me, like I have like the stigma against taking a medicine for psychiatric medicine, and like I'm thinking like, oh, I don't need that. I don't think they could possibly help me. But it's not until you do take it, the right medicine, that you can realize that it can help you, and it's like a switch. So that was good that finally I found, I think, a good balance for my mental health.
Yeah, it sounds like you did. Finally, that stigma, and many of us have to fight with that stigma of mental health and mental illness. Is like, oh, should I take this medication? Should I be involved with psychiatry? And it sounded like it took you a while to at least figure that was the best treatment for yourself. And now that you
Yes.
had that, you're in a better headspace. Sounds like.
Yes.
Okay. Great, great. And it is true. The best treatment for mental illness is medication with therapy. If you want the quickest result, those are the two directions to go. Um, I had a question from Janet. It said here, were there any time you didn't qualify for any services you needed due to physically and mentally thrive? Well, I think she's asking is it hard to get services being individual with your level of injury,
Well,
at least in the state of New York? Because I heard state of New York is actually pretty good. Am I wrong to hear that?
yes, when you have competent people around you, and you have good advocacy, and you get the services that you're entitled to, yes, they're great. And that's what I've gotten. And so I have to say I've had a lot of great services over the years, and I'm in a good program now where I can hire my own staff, and everything like that, and have that paid for through Medicaid. But like, for example, here's one like a snippet of like what happens. My mom advocated for me a lot. Without her, I don't know where I would have. So I'd say if you don't have someone advocating for you, or if you're not your own self advocate, it can be you always have to be your own best advocate, and then have a family member, a friend, or a social worker advocate for you also. Like when I was in the developmental center temporarily, waiting for a renovation of a group home, the second group home that I was going to go in. Then my mom bought the house first. So we're like, okay, so Derek can go back, come home, right? And they're like, well, no, because there's a waiting list for services. My mom says, well, he's already costing the state about $1 million a year to live in the developmental center. Discharging him home will cost much less than that. So there should be no waiting list, like that logic. And then she got a letter from the director, and then I got. So if you, I don't know, maybe that's a complicated way of explaining it, but it's just that my mom's advocacy allowed. Sometimes they'll say that there's a waiting list, or that people will like, not really care that they're telling you no, and then it's your life, and then someone advocating for you, you can change that.
Well, I hear two things, Derek. I hear your mom is an awesome woman. She advocates the hell out of it for you, but I also hear that money talks, right?
Yes. Yes.
So when they found out they could spend a lot less on you, all of a sudden there's no waiting list.
Right.
You're in the front of the line, Derek.
Yeah.
Okay. So tell me a little bit. How did you cope with your injury? What do you do to make it work for you? I mean, I have to admit, every day I wake up, I still wish I wasn't paralyzed. Every day I'm still a little angry, even though you would think I wouldn't be after 36 years. I mean, it's not that I spend all my days thinking about why I'm paralyzed, but there's probably at least one time every day that I wish I was doing something that if I see someone riding a bike, or I see something on TV. So what do you do to get through your day, and how do you do it?
Well, I'll say the good part first, and then the not so good part is how I cope.
Okay.
On good days, I'll do like at least an hour or two of reading to keep my mind going, develop my mind, because like another piece of solid advice that you've given is like how we have to refocus our values from what we can't do to what we can still do. So I take that to heart, and I try to say, like, I can still read, I can still, do things like that. I keep a journal, I read, sometimes I do artwork, I try to stay social with my friends. I have my job, so I try to stay busy doing productive things or enjoyable things. On bad days, I'll sleep most of the day. That's my sin, is I oversleep.
That's a great coping skill, isn't it? When you sleep, nothing bothers you, right?
Exactly.
I hate to say it, I used to use that coping skill a lot as well, because I don't know, when you sleep, you dream, you do all these amazing things, right, Eric?
Yes.
So you're saying you sleep a little bit more than you like right now, correct?
Yes, I find that the more events I have planned, like outside my house, the less I'll sleep. So it's more acceptable. But the more I kind of leave it up to myself just to do anything, when the morning comes, I'll be like, well, I'll get up and cast, then I'm gonna go back to sleep, and then I'll sleep until noon, and then we'll see what. So it's just at the end of the day, I'm like, why did I sleep all day? I wanted to do something today, and then I'm like, I lost all that time again, and I'm like, so it's discouraging. So it's not a good habit to develop, but
So first of
oversleep.
all, I'm hearing that caffeine puts you on a real regimen of doing it every so many hours, and you have to watch what you drink, correct?
Yes,
So
definitely.
that you don't blow up a big bladder if you drink too much, or if you forget caffeine. But the other thing I'm hearing is that, first of all, I hear that you're listening on my other podcast, so that's awesome. But so you refocus your values to something that you can, that you're interested in, and so you do a reading, you are doing some artwork, you're keeping yourself distracted, which is a great coping skill. What I'd love to hear is the employment part. How has working changed how you feel about life?
Well, it's always good to be needed. I think that that's always something that that is true for most. I think everybody, when they feel needed, they feel better about themselves, and it helps you have a more of more self-esteem and more healthy self-image. But um, I'm working part-time now, and I'm still on my disability benefits. One of my goals is to become financially independent, so I don't need my benefits. And right now I'm working on actually a cybersecurity training. I'm in a boot camp. I took another tip from you, Dr. John, to go into computers, because not just because I had the injury. It's something that I'm interested in too, and it's good, and it's a growing field, and it has there's a lot of opportunity there. So I chose cybersecurity. Yeah, I just feel more independence, and I feel more proud. I can be more proud that I'm earning my money instead of just having people give it to me, like disability. But it's a great program while I get on my feet like that. But
First of all, listeners, I did not pay Derek to say any of these things. So he's not being paid. So, but I do appreciate him promoting everything I've said so far. Cybersecurity is awesome. We have a great master's program here at ESU. So take a look at us, Derek, when you're ready. So I guarantee you love the program. So I'm glad you're doing a computer. Yes, I'm being employed. I've been fortunate. I've either been in school or always had a job, and having a job makes me feel like I'm worth it. Like you said, it's always nice to be needed. Now, unfortunately, being in psychology and counseling, that's all they want is to be needed. I mean, that's all I get is patients that are needy. So, I get a lot of that, maybe sometimes too much, but so you enjoy your work, and you're trying to be financially independent, which is an awesome goal. Now, does anyone have any questions for Derek? Derek, is there anything I didn't ask of you that you would love the listeners to know about your life and how you cope and what is important to you?
yes, I just want to reiterate two things. Maybe this is more rarer, but if anybody is not happy with their bowel or bladder program, has a spinal injury and is not and it needs a bowel or bladder program, has a neurogenic bowel and bladder and isn't happy with it, I would say research it and find an appropriate doctor, surgeon who knows about your issues to get a good resolution. Because I went 12 years without a bowel program. I'd wear a diaper and and most of the time I would just have an accident and then I'd have to clean myself off. That was very unpleasant and that was avoidable. I found the magic bullet, the suppository that's called the magic bullet. It works for me. I can sit on the toilet 3 times a week and I'm good to go. And that was one of the best things that happened to me since my injury, was finding out about the magic bullet and then about the Mitrofanov procedure for urology. That I can that I don't need an indwelling catheter. So search on the web, ask your friends, network, and try to find people that can help you also with your mental and emotional needs. And you shouldn't have to reinvent the wheel when it comes to accessing services. There should be someone that knows the system better than you that can help you along. So it's sometimes, and I know maybe you've heard, like, sometimes you just can't take no for an answer, but sometimes you just need someone that's competent to help you through. And it's not always ideal, but if you're your own best advocate and you have family and friends, that always helps. You can definitely have a good quality of life even after a spinal cord injury.
So if I'm hearing you correctly, Derek, I want to make sure I summarize correctly. First of all, 2 areas of your life, bladder and bowel, was a mess. I mean, being in a diaper for 12 years, literally that's a mess. And that is probably one of the most embarrassing things to have to worry about going out in public. So I can imagine how frustrated you were for those period of time. And just by going to some people who know what they're doing, and we're able to give you some recommendation, it sounds like you got your bowel program in control with a magic book. You know, isn't the magic bullet like a blender too? I think there's one, right?
What is that?
I think a magic bullet. I always think of the blender. So, but
Oh, oh.
but you got, so your magic book works for you, and then you the bladder. Now, Tim asked, and one of our listeners says, "Have you considered a colostomy ever at all? Colostomy bag."
I haven't, because at this point my bowel program works just fine for me 99% of the time. I sit on the toilet for an hour 3 times a week, so for 3 hours a week, pretty much every other day, and then I skip a day, an extra day to even it out. But that works fine for me. And I also find that by exercising and using my standing table, the gravity helps move my bowels down through my intestines of you standing up. So if you have a stander, and I've heard that pretty much, I heard actually from Nurse Linda that now pretty much anybody can get a stander that has a spinal injury, no matter what level, as long as you aren't, I don't know as long as your bones are still stable enough, something like that. But talk to your doctor. I'd get a standard that will help you enormously. You'll feel better, and you'll be helping all your systems.
So yeah, standing is always great for individuals like us who are, who don't get to stand. Your bowels and your bladder and your everything seems to work better when you're standing
Yes.
for a while. So, but you got to have good bones. Now, in coming back to the colostomy, I know I went there. I have several friends that went there now. We're 30 years post. So after all these years, we find our bowel routine just way too complicated to travel. So colostomy does solve that problem. But from those of you who are listening, you definitely got to talk to your surgeon, because it is a major surgery. Okay. Now, Derek, you're only, again, you're 2003. So that puts you, 19 years post injury. Last question for you then is 20 years from now, almost 20 years, has it gotten better or easier for you? Or do you think it's still hard?
It's gotten much easier. Much easier because I've been lucky, and I haven't had a major skin breakdown in over 10 years, because I have a cushion that works for me. I use the what's it called, Stimulite cushion, the honeycomb cushion.
Oh, I've heard of that. Do you like that?
Yes, it's yes. I still have to do weight shifts every hour, but that cushion has been the one that the only cushion I've used, and I've never really had a big problem with it. It's been effective. Taking care of myself, showers are pretty simple in the scheme of things, relatively speaking, because I'm pretty independent with them. Getting dressed, these are all things that I struggled with at first when I was discharged, because I would take a shower, get dressed, and then I'd go to the bathroom in my pants, and then I'd have to start all over again. That kind of a thing. So now that I have my bowel program under control and my bladder program under control, where I'm not having UTIs all the time, it's much easier.
Yes. You're not being hospitalized. You got your bowels in control. Yeah. However, the hard part about it is that if you ever travel, you have to have all these things.
Yes.
And that is an issue. I know for many of us who, I love to travel, but we always have to okay, how are we going to do this? How are we going to have those things planned out? One last question. How do you deal with spasticity? Janet wants to know, do you have spasms that are significantly enough that it makes an issue, or they are minor in your life?
Lucky for me, they're relatively minor. I find that by doing range of motion in my legs, like what I'll do is before every shower, before I get undressed for the shower, I sit in a butterfly position, my legs on my chair for a couple of minutes, just to stretch out my groin muscles, and just to stretch out, give my legs a different position. And then I will use my standard that stretches out my hamstrings. So stretching your legs, doing range of motion, is what works for me as far as reducing my spasms. But I never really had any problematic spasms.
Okay.
I was lucky. I'm lucky.
Well, we are almost about 10 minutes into our hour, which it always goes so quickly. I want to thank Derek for coming on and sharing his personal life. Sometimes I know this is hard, so I'm gonna thank you, Derek, for coming on and speaking with us and allowing us to dig deeper into your life and how it has impacted you. I am so happy that we got a different perspective instead
Well,
of mine. Because not, everyone has a different way of doing things. So Derek
yeah,
has picked and choose a little bit of things I've said that makes work for him, but not everything I say works for everybody. So yeah, you have to trial and error, right, Derek?
yes. Well, thank you for having me, and it's my pleasure to share my story.
Thank you, Derek. So I'm going to take the opportunity in the last few minutes just to go over some registration questions and statements. So let's see. So Ali from New York says, what are some effective ways to find long-term caregivers? I have to say, I've put a lot of ads out before. They never work. I don't have very good um, responses from websites that you see out there that for caregivers, they don't work. Where I do find, and it doesn't come often, but usually when someone refers a friend, because first of all, if they're your friend, you're not going to refer someone that's going to be a jerk to you. So usually that's a good. So um, so that's where I had the most success is when you have. So if you have caregivers, ask them if they have friends who are interested, and or if any of your friends know somebody who aren't caregivers who know caregivers. So usually that's the way I go. How to handle difficulty finding caregivers after you relocate? Well, Ali, that's a tough one because he just threw out exactly what I just said as a way to find a caregiver. So you relocate to a new place, you don't know anybody, and you're gonna have to find people that are responsible and reliable. So now you're going back to just looking for ads and finding new people in the beginning. So that I don't know if I have any information on that one, suggestions on it, because you're just gonna have to struggle through and put some ads out. It says, especially when you don't have any family members in the area. Yeah, whenever I used to transition way back in the beginning, um, my mother was the one that helped me transition into finding new people. Um, However, now I haven't moved from this area in such a long time. I haven't worried about that issue in a long time. How to extend or enhance the quality of my life? This is from Janet. How to extend or enhance the quality of my life without support or personal care assistance, especially around the clock help. Well, I want to make sure I understand the question. How to extend or enhance the quality of my life without support or personal care assistance, especially around the clock help. If you don't have support, it's hard to have a good quality of life in my eyes. I am a people person. I love interpersonal interactions, and it's hard to think about life by yourself. So you need to find that support. You need to find those friends. You need to create new friends. You need to find people who have common ideas and values. I had a friend tell me the other day that um, they felt isolated and lonely, and they were gonna join a group of a similar, that had similar interests. And I was like, that's awesome. So for us people with disabilities, peer mentors are a great place to start. Being around people with disability is where I would start to find people to hang out and have like-mindedness. I don't get to see enough of my friends who have disabilities. I love when I'm with them because you can, because you just don't have to worry about that they don't understand something. They all understand what you're going through. having personal care assistants around the clock, that is, that's hard. In one way it's easy, in one way it's hard. One way it's easy is that then you can get your needs met. I like having some alone time periodically, so having someone around all the time is not comforting for me, although I need to have people around. So it's a catch-22. I think Derek talked about that, having that balance. And let's see, Curtis asks, is there anything I can do to relieve the pain and stiffness that I have both hands? And then he also asks, pressure sores on my bottom and pain in my hands. Well, I can talk about the pressure sores more than I can talk about the pain in your hands. Now, when it comes to pain, at the rehab, I used to hear the physical therapy and OT occupational therapists talk about stiffness. Like you have to use them regularly. The more you use them, even though they're painful, the less pain you'll have in the future. So it's painful to use them while you're in pain, but it decreases the pain in the future. And because if you just sit around and it becomes stiff, then obviously it becomes worse. Now, when it comes to pressure sores, I am going through that a little bit. It's gotten several weeks to have my sores heal. And part of it's just my problem, just not weight shifting enough. Derek says he has to do once an hour. He knows the cushion he had. I'm going to go get some pressure mapping at Kessler and, try to find the right cushion. As you get older, your skin gets thinner, and this is just going to be a problem for any spinal cords as you get older. So, and many years post-injury. So those are some of the few questions I had. Donna, if you have anything that you showed up, I think I covered most of them. And let's see, one post question from Jana: how do you balance taking meds that makes you sleeping and staying awake to do homework assignments? Okay, that's a good one. And being a professor, I would say this: a lot of your pain meds, a lot of your anti-spasticity meds, are going to make you tired and sleepy. Any anti-anxiety meds are going to be, it's going to make it side effect of sleepiness. So it's really important that you maybe take them at a different time. So if it's studying is more at morning, take those meds at night. If studying is more important at night, take those in the morning. So try to do the best of timing so that you're awake, because if you're not awake, obviously you can't study. And if you're going to go to college, and I'm biased, go to college, getting a job like Derek's doing, go into something computer science, man, you're going to have a job, no problem, especially in cybersecurity. That's a great way of feeling good about yourself and be financially independent. So I want to thank everyone for coming today. I hope that, going deeper with an individual and hearing their life helped with understanding about improving quality of life today. We heard from Derek, and I appreciate, again, Derek for coming on and sharing his personal life with us. Listeners, let me know on the ratings how I did. Tell your friends about our podcast, our monthly podcast. And I want to thank everybody for coming today. Have a good day. Bye-bye.